The state of Namibia's health systems is a subject that is constantly under scrutiny. It is challenged by many issues, but above them all is the lack of funding and the lack of resources, including personnel. In the 2021-2022 financial budget, just over $8 billion was allocated to health and social services. This amount, according to the Finance Ministry, is slightly more than what the government estimates was spent last year on health. This is about $30 million more. The health system has been challenged by COVID-19 as well in 2020, especially because resources had to be stretched to accommodate the influx of patients. I'm Arlana Shikongo, and today I'm joined by orthopedic surgeon Dr. Stanley Kanyemba to discuss Namibia's public health systems. Doctor, thank you so much for joining us.
Alana, thank you for welcoming me. Thank you for inviting me to your program. I've been looking forward to coming here, and I hope we'll have a lively discussion.
I hope so too. And really, it's an information session just to inform the public on, the public health system, the challenges, the things that it's doing well as well. So I think to get started, let's jump right into it. One of the biggest problems we know is the lack of funding that the health system experiences. So could you talk to us about which areas of the health system really feel the pinch of a shortage of funding in the country?
Alana, because this is an information session, allow me to paint a picture of the healthcare system by introducing myself. I'm Dr. Stanley Kanyemba. I was born in Chumep. I grew up in Chumep. I went to a little primary school just across the street called Nobcho Primary School. And for high school, I came to Windhoek. Went to a school called Concordia, a very prestigious school at that point. Once I finished my studies, I thought I wanted to be an engineer. I went to UNAM, but somehow at UNAM, that's where I discovered myself. And I discovered I've got more interest in health rather than medicine. So I contacted a friend of mine that was in Durban at that point, asked him, okay, what's this medicine thing about? I really like it. He told me what it's about, and then I went for my undergrad studies to Durban. I completed my undergrad studies, and then I came back to Windhoek. In Windhoek, I did my internship. And at that point, I got to know the public health system quite well. Now, because I studied with loans, I decided, okay, I need to pay my loans off. And then I decided to join NAMDEP, Oraniumont at that point. I stayed at Oraniumont for about 2 years. I managed to pay off all my debts. And then I realized, look, I wanted to be a specialist because at that point, I was still young. I still needed to study some more. I left again to South Africa. This time I joined Chris Hani Baragwanath Hospital, the largest hospital in Southern Africa at that point. And through Chris Hani Baragwanath, I joined Wits University, where I became a specialist. After my specialty, I came back to Windhoek around 2016, about 4 years ago. And I've been in the system since then. I think when one looks at health, one shouldn't look at health as just a public health. One should look at it in terms of the complete healthcare system. Now, when you look at it as complete healthcare system, you start realizing that just like the education system, because I think I would like to compare it to the education system. It's a system that needs coordination from both private funding and public funding. Now, because I had the experience of working for NAMDEP Hospital, I had the experience of knowing what private funding can do for the health system. Public funding, I was born slightly before independence, so I have a recollection of what Namibia used to be before independence. Then I have a recollection of what Namibia is after independence. Now, when I went to study, especially in the South African healthcare system, you get a deep understanding and training into healthcare systems, especially public healthcare systems. And South Africa, amongst the African countries, is one of those countries which has a very advanced healthcare system. Now, without talking any jargon, what do I mean by a healthcare system? Now, for me, from my profession, we divide the healthcare system in four: primary healthcare, secondary healthcare, tertiary healthcare, and quaternary healthcare. These terms are important because they will make you realize that it's an upward referral system within itself. Now, having said that, there is three issues when you're looking at somebody in terms of how you look after somebody. The first issue is you want to prevent the person from getting sick. The second issue is you want to treat a person when they get sick. And then third issue is this person shouldn't become financially burdened by this treatment.
Yeah.
Now, when you look at the world has about 200 countries, yeah? Out of the so-called 200 countries of the world, there's only about 40 countries that have actually managed to develop a healthcare system. That will show you that a healthcare system per se is not really an easy thing to master.
Yeah.
I think, are there any questions at this point before I get into the next point?
No, you can get into the next point. Go for it.
Now, when you look at it in terms of that, there are four different types of organization of healthcare systems. The first system is called the Beveridge system. The Beveridge system is the system that was developed by William Beveridge, and it's akin to the British healthcare system,
Okay.
what they came up with there. The second healthcare system is the Bismarck healthcare system. It was developed by Otto von Bismarck in Germany when they tried to unify Germany in the 19th century. Then you have something called the National Health Insurance System. The best example of a national health insurance system is Canada. And then finally you have what we call an out-of-pocket system. Now the out-of-pocket system is what we have in the majority of Africa. Now you find that because of that, the funding of the healthcare system is actually very state or government based. The government actually directs where the funding comes from for a healthcare system. So the first thing is funding, then it's the administration of those funds, and then it's the service provision within the administration of those funds. What do I mean by service provision? Service provision means in terms of human resources and infrastructure. Now you will realize that human resources have to be trained, developed, and maintained. Infrastructure has to be trained, developed, and maintained.
Yeah.
Now, pre-independence Namibia, if we step back, there was really no system. Now, independence came, Namibia got established by our constitution, we became a sovereign state, and at that point, we were supposed to sit down and say, okay, which healthcare system are we supposed to adopt from the four examples I mentioned? One doesn't want to say there was no effort in doing that. There were other complications and one understands why the complications were there. But Namibia is left with a public system and a private system. You would also realize that in the private system, it's really just for the middle class and the rich.
Absolutely, yeah.
You would find that somebody that in Namibia has an 8,000 would not be able to afford the private healthcare system. So I think let's start off our discussion from that background. I think that background paints the discussion forward.
Absolutely.
Yeah.
Just a point on mentioning now the private and the public. Those two sectors are completely disproportionate, as you just mentioned. Most people cannot afford the private sector unless, of course, they're middle and upper class. And then, of course, the public sector is then left for everyone below that. Now, thinking about these four systems, healthcare systems that exist in the world and that we remained in the out-of-pocket one, what difficulties or what has challenged us from exploring these other systems, especially when we're seeing how they work in other countries?
as a born Namibian, it's a very interesting society. Currently, I'm working for both public, and I'm also a private specialist. There are certain conversations that we need to set around the table. South Africa is forced to come to that conversation through their national health insurance system. You'll find that in Namibia, there has been concerted effort by government especially. And one must commend their effort. I mean, Ministry of Health, through their 14 regions, have national regional health directors, and they have about 260 health centers. They had about 1,100 outreach centers, and then now they have 3 intermediate hospital, and then they have 1 referral hospital. That's from the side of the Ministry of Health. Government has gone further under the Social Security Act of 1994, where they realized that, hey, we need to do something about health insurance. Still, we haven't really figured out what exactly, but we'll try. We'll try. So let's do maternity and sick leave, and then injury on duty, and somehow let's compensate. But payment for the health service itself, let's discuss it. And so far, they came up with what they call National Health Insurance Fund. It's a fund under the Social Security Act. I think they came up with it in 1995. But we still haven't gone to the table to say, from these 4 types of systems, what are we saying? Are we saying like the von Bismarck system, where it's the employer and the employee that pays for health, government collects those funds and then administers? Or are we saying we're going for the British sort of system, where out of the taxpayers' money we pay for health? Or are we saying we're going for a national health insurance system? Now, when you read the Social Security Act and you look at Social Security as a fund, it looks like they're going more to a mixture of von Bismarck and national health insurance system. Those moves have to be made. The uncomfortable conversation has to be had. On top of that, 2015, United Nations comes up with what they call universal health care. Now you're seeing that there is a move, because when you look at Chapter 3 of our Constitution, there is no specific mention in terms of right to health. They speak about right to life, but there's no specific mention on right to health. But we are part of the United Nations, and under those declarations we have actually signed that we say Sustainable Development Goal 3, where they speak specifically of health, that we have to provide health. And therefore, that conversation has to be moved on to say, look, this lack of funding, where are we going to get these funds? Are we going to tell the taxpayer, like, look, for every dollar we'll deduct an X amount, we'll create a social institution, and everyone has access to the same health care? That's perhaps the next big discussion, and that's why I'm excited to be invited to this program, because this is where the conversation starts. And this is where we say, invite the different role players and let's see how far along we've come. The current system, we cannot talk about it unless those conversations. Do you understand how I've painted the picture for you? And therefore we cannot even discuss what's happening currently. Because what have we done? We've merely adapted something from apartheid. We've moved into the apartheid hospitals, and then we now want to provide. It's inadequate by its very nature.
I think then that brings rise to the question of what exactly is this national health insurance system, right? Because now this is a next step. We're moving on from something that we've just adopted, trying to figure out our system for ourselves and how to make it work for our population. So what exactly is the national health insurance system? And then with us, you said the National Health Insurance Fund. What does that currently do? And then third to that, how does it fit into the universal health care plan?
Okay. The universal healthcare plan, and I was excited when we were trying to invite the United Nations, because it is a very brave move. I think the world is starting to realize that too many people are left out. Sustainable Development Goals, there are about 17 of them. And Sustainable Development Goals, I think United Nations is a very interesting organization. I think Namibia also owes a lot of its existence to the United Nations. I mean, they midwifed us. I mean, they handed us, they handed us over to the national government of South Africa. They midwifed us through the process. They handed over our independence. But now they're coming up with the Sustainable Development Goals, where they're saying by year 2030, there are 17 goals that internationally we all have to achieve. And health falls under Universal Sustainable Development Goal 3. What Sustainable Development Goal 3 came up with is what's called the Universal Healthcare. Universal Healthcare basically is a declaration, because you must remember that when we look at health, there are certain priorities that especially African countries think that mother and child is, for example, a priority.
Yeah.
But universal healthcare is saying, no, every human being is a priority. From the day you are born until the day, from cradle to grave, everyone is a priority. But we are saying that there are certain disease conditions within those priorities that is supposed to be your right, that you need for you to live a healthy life. However, when we provide you with those the care to those disease conditions, it mustn't leave you out of pocket. So it's basically a recognition of the challenge and a solution for the challenge. Now, out of universal healthcare goals, we came up with disease control priorities. Disease control priorities are about 13 topics under which universal healthcare will provide healthcare. That's a much deeper discussion. Coming back home, Social Security Commission, it is a very important fund, and one must acknowledge what the government is trying to do. Unfortunately, the divisions in Namibia are still very big. I experience it when I work in both systems, in the private system and the state system. I'll give you an example of what happens in the private system. I'm an orthopedic surgeon. So as orthopedic surgeons in Namibia, especially in Windhoek, we have agreed we form a group. It's an exclusive group. So we become part of a group. Now, as part of the group, we divide the month into calls. So we tell each other, you're on call today, you're on call tomorrow. This creates an interesting phenomenon. Because now, if you break in Windhoek, now, you don't have a choice which orthopedic surgeon you go to. So now, suddenly, what this has exposed me to, and I must acknowledge the challenges of individual Namibians, and I must acknowledge those patients that came to the likes of me. Without going into specifics, you can see when your name is mentioned, so the orthopedic surgeon on call is Kanyemba, and I'm getting called to Lady Bohamba Hospital. And certainly there's apprehension to who's touching me. And I think part of the healthcare challenge and discussion is in terms of those things. How do we bridge the gaps of the past and how do we move ahead? Those are the discussions rather than it elevates all of us in terms of, look, we have to realize that healthcare is one of those things that every human being needs.
Absolutely, yeah.
How we divide it and who divides, it's not the story of just government. It's not the story of just the doctor or the PPE. It's about how we organize ourselves as a society to say that we will look after ourselves. Let me allow you to get in, because health is...
I was going to say, have we allowed ourselves, though, like my question is, have we allowed ourselves to adequately determine how we are able to take care of ourselves and making sure that everybody has access? Because as you said, not everybody has access to certain things or adequately has access to certain things. So why is that something that remains a challenge if there is this sort of ideal thinking of what the framework of healthcare should look like for a country. What is the challenge?
And that is the role of programs like this. This programs like this goes above political parties. It goes above government interest. It goes above NGO interest. It goes about saying that HIV is a priority. It's beyond HIV. It goes about saying beyond maternal and child health. Because now you're saying, like, look, we have a funding challenge. We cannot fund, for example, 7% of government GDP is used on health. Is that adequate? If that is inadequate, do we all agree? Not just one political party or one ministry. Do we all agree that everyone needs to access healthcare? If we do, how much does each individual in the country contribute to the kitty for that healthcare to take place? If we do agree to that, how is this service provision going to take place? There are interesting institutions that government has created, like the motor vehicle accident funds. There's another very interesting creation of government where car accidents cause a lot of trauma. And there was an acknowledgement that special funding needs to take place in terms of looking after these victims of car accidents. And you can see the difference. You can see where somebody from a village in Namibia comes and lies in Mediclinic. You can see what that does to the person's brain and how much belonging it creates. What I have done further is that in terms of what the system can provide to this person to make him feel as part of this society. So I'm telling you, and I'm appealing to you and saying that healthcare is much more than a single discussion about PPEs, because we are not there. Like I told you, primary healthcare, secondary healthcare, tertiary healthcare, quaternary healthcare. Let me give you an example of a primary healthcare facility. Primary healthcare is usually a clinic staffed by a nurse that's usually located in a township. How many clinics do we have located in a township staffed by across Namibia? And how much access and funding do these clinics have? That's the discussion. The next level of care is secondary healthcare. Example of a secondary healthcare facility would be your local hospital. Again, Ochivarongo Hospital, located closer to the people. How many facilities do they have? What are they able to do? Then on top of Ochivarongo Hospital, you have you have 3 intermediate hospitals. Oshakati Hospital, Kadutura Hospital. Now you're also getting Rundo Hospital into play. That's the next level. And then we have one final referral center. Credit to government, lately we have established a medical school and the staffing is getting on board in terms of who will staff those places. But again, in terms of funding, is it just the role of government or how much private sector have you seen that have funded?
I mean, that provides very interesting perspective, because I think that the idea that you're getting at is that in general, people think of healthcare systems as these silos, no?
Exactly.
But it kind of is stretched in terms of, the 4 levels, and then of course having to think about the various conditions or what is priority, doing things that, as you mentioned, the MBA fund. So when thinking about all of those things, not everything can get attention, no? So there are some things where the funding won't be enough, some things will fall through the wayside. Maybe a primary care facility in Okahanja won't be looked after because, there's so many of them and things are falling through the cracks. So I guess my question for someone that is in the system is, how can we, both in the public and private capacity, do a better job of making sure that on the basic level, of just making sure that the resources and the, as you said, administration is happening and is being funded? How do we make that happen?
So in a way, I've introduced a few controversial topics. In a way, I've actually said that current healthcare is not the way to go.
Which is fair.
In a way, I have said we need to create another system. In a way, I have said we need to create the platforms for the conversations to create another system. How would we create this platform? Invite me more. Let's discuss. Let's talk.
Absolutely.
It is when you look at various indices of health, you know, such as mortality rate, infant mortality rate, or you look at in terms of life expectancy. Yeah, life expectancy is a nice one. If you look at the general curve of a European society, yeah, it's in the middle. It's big in the middle, and it goes tapers to the top, tapers to the bottom.
Yeah.
You look at the typical life expectancy of an African society. We have very young society.
Yeah.
45, 55. You understand? Now, this type of discussions in terms of providing healthcare will ensure that life expectancy is improved.
Yeah.
Therefore, those discussions of saying the Social Security Act in terms of what they have proposed, what are we waiting for? When are we going to discuss the National Medical Benefit Fund? How much research is enough research? When you read literature around Social Security, and what they are saying is that they're still busy with research. Private health insurance, those are interesting people. They are very moneyed, and they don't like sharing their money. But there's a principle. I was discussing with one of my friends, and in terms of within healthcare, we also have these discussions, where one of my friends was saying, all of us are just working hard so that we are rich enough so that poverty doesn't touch us. My friend, if you are driving a Range Rover and there's a pothole, huh? Will your Range Rover protect you? Therefore, that is the bigger discussion to the haves, to say the pothole theories of society, where there is infrastructure that needs to be maintained beyond your individual health. That is what a society means. And I think I'm becoming successful in convincing you that that discussion needs to take place. And until we have that discussion, currently, given what government is given, they are doing very well. I work in the system. I know the system. I know what it's able to do. And it's not failing because there is no funding. Namibia is probably one of the societies that pumps the highest, in terms of African society, pumps the highest GDP into health. But you cannot keep kicking a dying horse and expecting it to plow. I mean, it doesn't work like that. The horse is dead.
Exactly. And I think that COVID honestly just exacerbated the situation and made it worse, because these problems that people observe, the reason that the system is constantly under scrutiny, it's not because we're looking at it from aerial view. It's that people are going into hospitals and things are falling apart. People are sleeping on floors. Clinics are not open or they're understaffed. And the potholes, as you call them, are so evident. They're so obvious. But it seems that there's constantly an attempt to just kind of put a bandage over it rather than figuring out how to fill the pothole. And I think that feeds into what you're saying, is that there's many smaller conversations that need to happen before we actually figure out how to fill the pothole. But we have problems that are happening right now. I think, how many videos does the Namibian put out of people sleeping on floors? The hospital beds don't have sheets. Just these basic problems are always attributed to government, because these are government facilities.
I'm trying to answer you.
So the question that I'm getting at is, rather than just thinking of these bandage solutions, how do we fix the problem? How do we actually elevate our healthcare system?
Amongst the discussions I had, especially within our private circles, is I've called for a social fund the fund that was created by COVID-19. Sorry for saying that. COVID-19, especially for my profession, has brought the profession to the fore. It has allowed me, you guys, to invite me. The way it actually came, without COVID-19, I don't think you'd have ever spoken to me. But we are seeing that, and look, pandemics are part of, becoming a doctor has allowed me to appreciate life differently. You know, we're not the only living things. There's more to us.
Yeah.
Let's not go into that. It's a different discussion. But when it comes to us, the discussions that we need to have is that the fund that was created for COVID-19, where did it come from? You see so many companies suddenly giving. Is this fund going to be called a healthcare development fund? I dare you, Namibia, to call it the Health System Development Fund. Why is this important? For a complicated system like health, you need to fund it daily, you need to fund its development, and you need to fund its maintenance. As Africans, yes, that is what I wanted to say. There's things that concern me about us as Africans. First of all, is African denialism. If you tell an African there's a problem, I promise you, he will kill you before he admits that there's a problem. Second thing is our lack of appreciation for planning for the future.
Yeah.
Thirdly is our lack of planning for maintenance. I think those three things. I'm happy that there's a Namibia Statistics Agency. By the way, the guy who's the CEO there is one of my seniors from Concordia. That data, don't generate data for fun. Windhoek Central Hospital was created for apartheid, for their people. Karutura State Hospital was created by funding from Germany because the community in Karutura complained. These things were not created for independent Namibia. Now you're worried about people sleeping on. Well, there's something wrong with you. These things were not created for you. Where is yours?
Yes.
Yeah? After you grade yours, now you can come and go. You've never graded yours, have you?
I mean,
have you graded yours?
Have we not created through
where have you built
Our Lady Pohambas? Not me in
Our
my
Lady Pohamba,
in my individual capacity, but in Our Lady Pohambas and our private hospitals. No. Are those not ours?
By who created? Let me not get into Lady Pohamba. But you realize what I'm saying?
Yes, yeah.
So when you are telling me you are sleeping on the floor, you build those houses. You know, sometimes Africans, you know, you grow up as a baby, you are still staying in home with your parents. Then you complain that you're dead. It's his house. Move out of that. Build your own house. Then start complaining. Post-independence, we haven't built a single hospital. I don't care. And this has nothing to do with who's running the country. It's what is your name again?
Arlana.
It's you. You haven't built a hospital. So I blame you.
Okay.
After you build a hospital, you can come and ask me, where did you sleep?
Okay, but Dr. Kanyemba, I pay taxes. Do my taxes not go to hospitals and our public system? Because my assumption is that because I pay taxes, I'm putting my money in a pool for the country, right? And my expectation is that certain things should take priority. Health is one of those things. Health should take priority. If I don't have health, I don't live. So why is my tax money not going?
You are part of youth. I hope you voted. Did you vote?
I did vote, yes.
I'm happy there's no... You see now, this is why we have this type of programs. Because society needs to start acknowledging that countries require activity. Look, I'm an orthopedic surgeon. I've got no business sitting here and talking about health systems. But I have to talk about health systems. Because if I don't, who will? And that's if once we take that attitude, then things will change. Because we take no interest, except smoking humbly and whatever, in the bigger issues of what needs to happen. And after we take interest in what needs to happen, and we demand for a space, we demand for delivery, and then these things will happen. If they say, then you You need to volunteer for these things to happen. I've said, Social Security has discussed national health insurance. Why is this thing shelved since 1995? You cannot tell me that we are doing research for the past how many years? We need to see those things right now.
And I'm sure that, as you say, in the medical profession, these conversations are happening, but as public, we're not necessarily privy to those conversations. So then, just from your experience, being in those circles where these things are being talked about, what is our future looking like in terms of the growth of our health system and the improvement of it?
The fact that you and I are talking about health today it's a brighter future. The fact that you and I are safe talk about these big topics. But the conversations, I hope we have a follow-up conversation with Social Security, with Ministry of Health, and with funders. And then we have these discussions that say, perhaps on bigger platforms. The fact that the newspaper has taken the next step to become social media and then acknowledged, that for me gives me hope in terms of what's going to happen in future, and then we just keep pushing. I always say, without being political, but sometimes one has to be. Others had to die. I mean, you and I, the only thing we have to sit in is in a room without aircon. It's two different sacrifices.
Yeah.
So why don't we get involved? I think those will be my words.
Absolutely. And I think that an important point is that it's a collaborative effort. We cannot expect the public sector to do it on its own when the private sector has shown us that if they throw in as well, we can make things happen. COVID exposed that because, like you said, where did the money come from for all of these COVID facilities and everything that we needed? Definitely a bigger conversation to be had here, and I do hope that we can in the near future have a follow-up, because I'm certain that our audience also has a ton of questions, a ton of comments that we didn't have the time to get to. But we're nearing the end of our show. So Dr. Kanyemba, thank you very much for coming in. To our audience, thank you so much for tuning in this evening. If you have any comments or questions for myself or Dr. Kanyemba, please feel free to leave them in the comments. We will hopefully have a follow-up conversation in the future.